Hi Anne, thanks for talking to me today.
Hi Emma, how are you doing?
I'm very well, thank you. Can you tell me a little bit about you and your background, please?
So basically I'm a GP and I do general GP care with a specialist at the moment looking after the population who the practice serve, which is often more disadvantaged. But my other background is that I have done extended roles in gynecology and also reproductive health, contraception, sexual health. And through that I do some hospital-based work, particularly about menstrual disorders, but I also run specialist clinics within the GP practice, doing contraception, menopause, fertility problems, female incontinence, and more women's health related work. On an individual level, not only have I got the experience of working as a GP and also a GP with special interest in women's health, but I've also got the experience of commissioning. I'm the CCG board, the Clinical Commissioning Group board member with a remit for maternity, women's, children and young people. And so I understand the political environment as well and some of the opportunities that are coming up with the NHS long-term plan. So I can offer advice about resources that primary care need, but also think about how we can start to improve provision of care for women across the system. 2 years ago, the Royal College of General Practitioners, in response to an all-party parliamentary group report on women's health, established a clinical spotlight programme for women's health. It was really aimed at focusing on menstrual dysfunction, although we're gradually expanding the project to develop other aspects of women's health resources such as menopause, reproductive health. So I'm the clinical champion for that, and I often represent the RCGP at parliamentary group hearings, give evidence to the Health and Social Care Select Committee, write resources, and we're developing a toolkit of resources for busy GPs to use.
Fantastic, and it's wonderful that you're focusing on women's health because it's an area that really needs a lot of attention. Can you tell me about the Primary Care Women's Health Forum?
The Primary Care Women's Health Forum is a network of primary care clinicians around the country. It started as a few of us who had more expertise in women's health, and gradually we've grown to this massive network of primary care clinicians, about 11,000 members altogether, and we develop resources, educational tools, share best practice, do webinars, conference, other events to try and improve the education and the profile of women's health around the country.
Fantastic. So obviously you do a lot, you've got a lot of hats. What drives you in your role?
The main driver I have is my passion for improving women's health and reducing inequalities. Lots of women tolerate a lot of poor well-being, both mentally, physically, socially. The impact of some of the problems such as period problems, menopause, not being able to predict when they can choose to have their families, that impact is felt by women. We haven't got the system right, that women have the same representation on national committees, that the priorities in primary care are fair for women. And so I do what I can to try and raise the issue about inequalities for women, but really specifically for the diverse population that I look after in Bradford, who really don't have a voice.
Okay, on the subject of women's health, what are the biggest issues facing women's health at the moment?
There are many issues in women's health. One of them is about the lack of prioritisation. So the lack of prioritisation by clinicians, by politicians, and the lack of awareness that women have about what is normal and when they could go to get help. From a clinical point of view, the particular issues are around reproductive health and the fragmentation of accessing care and the commissioning arrangements, but also about how the changes to what women need are different at different times of their life. Period problems are an increasing problem. Menopause is becoming increasingly acknowledged as an issue for women. So many different problems.
Okay, if you could wave a magic wand and make 3 changes to women's health, what would they be?
So the issues for women's health are really, you can categorise them into three groups. One is about the individual woman. It's about her needs. It's about how she can be empowered to go and talk about the problems that she's got and get help. But she doesn't know she can get help unless she realises that it is an issue for her, and to help her have some tools to use to reduce the stigma and make it easier, empower her to be able to discuss the problem. I think from a primary care angle, it's about continuing to improve resources that doctors and nurses can use to help them to understand what's out there, what's available, and to be able to offer better support for women in a streamlined way. And I think politically it's a drive to understand the inequalities and to really appreciate the impact that reduced funding for women's health and certainly reproductive health is having on society.
Fabulous. You mentioned that one of the biggest issues is around menopause. What can be done to help raise awareness of menopause amongst healthcare professionals?
Issues such as menopause, but you could use the same for heavy periods, incontinence. The problem is that there's a sort of a normalisation, an expectation that women should tolerate symptoms. And also, we don't really know how things affect us compared to others because we don't talk about it, we don't grade it. You can't do a blood test or a measurement that says you've got it bad, you've not. Problems come and go, and sometimes they, by the time you've got an appointment, they are a little bit better, so you might change your appointment. Since the publication of the Women's Health Initiative study, menopause has really gone on a back burner. Many clinicians are worried about prescribing hormone replacement therapy. Many women are concerned about asking for hormone replacement therapy, although we know that that is the best way of helping with menopausal symptoms. So one of the issues for primary care clinicians is that we need up-to-date resources. We need easy-to-use documents. We need myth busters. We need nuggets and shared good practice. The BBC Breakfast series on menopause really did highlight to women that they don't have to tolerate the symptoms that they have and that there is help out there. So driving women with information and empowering women to be able to go and ask for help is a good way forward. But then we've got to be able to provide clinicians with easy enough resources to use. The problem is, as GPs, we have to know something about virtually everything, and that is really hard to keep up to date with, especially as sometimes when the guidance is written, evidence comes out very quickly that contradicts it. So the Primary Care Women's Health Forum, we develop pragmatic, practical resources for use in primary care so that clinicians can feel that this is right for them to use because it's been written by primary care clinicians in a way that they can use easily and can reference.
So you mentioned the BBC Breakfast Menopause Week. That was fantastic. I understand the PCWHF launched a public-facing Rock My Menopause campaign. Can you tell me some more?
Absolutely. It was the first time we've done something that's been that public-facing. And the Rock My Menopause campaign was really about raising awareness. It's got resources online so that both clinicians and women can access some very well-written, easy-to-use resources. And also there's a Facebook page, and that is fascinating to watch because it is women supporting each other with questions, challenges, information, and it's helping us as the experts think about what further information to develop so that we can continue to support women with their questions. But we're not giving them clinical advice via that. It is them really empowering each other to either do self-help improvements or to when to go and talk to somebody else, a clinician or a pharmacist, to help themselves.
Fantastic. Sounds like it's really going well.
Fantastic. Absolutely amazing uptake. Amazing numbers of women registered for the Facebook page, but also amazing numbers, unbelievably, really unanticipated numbers of women accessing the resources and using them.
HRT still has a bad reputation. Can you help to break down the myths?
So the big problem really started with the publication of the Women's Health Initiative report several years ago now. And that was newspaper headline hitting with statistics that were played with to make them sound much more concerning than actually they were if you use the absolute numbers. Over the years since then, there's been much more significant, much more important research come out to support the use of HRT and to show that it's very safe and actually very good for women. But unfortunately, the statistics don't make the same headlines. So it's sort of gone under the radar how good HRT is for many women. So the Primary Care Women's Health Forum, we have developed some resources, we have a Mythbuster, we've done some webinars, we've done the My Menopause campaign, and what we're trying to do is give women the information that they need to make their own choices, because it is an individual need, it's an individual assessment for what's right for you at what stage of your life. But you and your clinician can't make that unless they've got the right information in front of them.
There have been a lot of reports of drug shortages at the moment, especially around HRT and contraception. What's your experience and what can be done?
You're correct, there are concerns about drug shortages, and it is happening in reality. It's hard as a GP when we're so busy then to have a message from the pharmacy or from the woman saying that this drug isn't available at the moment. It would be more useful to have regular updates from our pharmacy advisors or for the medical IT companies to perhaps be able to help us with that as we're printing out the prescriptions, but it's very difficult at the moment.
Our recent trust survey showed that a third of healthcare professionals couldn't trust the pharmaceutical industry. Why do you think that is?
The pharmaceutical companies and as advisors, we need to be very transparent. We need to be much more open about relationships, but we need to be able to demonstrate any relationship that we do have with pharmaceutical industry or clinicians is in the best interest of the patient. So supporting the development of resources, medication, whatever it is that is right for individual patients in a much clearer, open way. The increasing need to provide hands-off grants is better so that pharma can support initiatives but without having to be able to control what goes through the work that's being developed. That will get much more trust in the system. I don't think we can manage without pharma support with the cuts to the NHS, so we do need to continue to work closer together.
So what expert support does the forum give to pharmaceutical companies?
The Primary Care Women's Health Forum have a number of experts around the country. We have a big membership, but we also have some very highly experienced and specialist general practitioners and nurses who are involved in all sorts of work. Some are menopause focused, some are reproductive health, contraception focused, some are more general GP with special interests, some are nurses, some are more involved with commissioning. So we can support initiatives for pharma by offering development of resources such as Mythbusters, recognising that that's what actually primary care clinicians often need. We've developed some patient-based resources. We do webinars. What primary care really like is to know that the resources they're using are advised, recommended, developed by clinicians who sit in those clinics where they are. So they understand what the needs of the women are who come to them. They understand what their carers' needs are. They understand how it feels for that woman and what's available out there. So we use research, we use specialist knowledge, but then we can develop pragmatic resources and support pharma in whatever actually they want. But that's what primary care clinicians want and need actually.